Today's topic is PCOS. Many people confuse PCOS with PCOD, so I'd like to remove your confusion. PCOS is a hormonal imbalance. However, PCOD is ovarian cysts, ovaries that are affected with ovarian cysts. Assalamu alaikum. My name is Dr. Fatema Juma. I'm a clinical nutritionist, women's hormonal health specialist, and a PhD in food, metabolism, and clinical nutrition. Today, our topic will be PCOS, considering it's September, PCOS month. So what is PCOS? PCOS is a hormonal imbalance affecting more than just your periods and sexual health. It affects your mind, it affects your body, it affects your mental health, it affects your physical health and emotional health. You'll be wondering, how can I know if I have PCOS? So there are more than one symptom. That is why it's called a syndrome, Polycystic Ovarian Syndrome, because it's a whole packet of symptoms. So the first one will be irregular periods. Many little girls who are starting their period, the menarche, going up till maybe the age of 35 experience like they don't have proper cycles. 3 days, 7 days, 10 days, it's just not set. Second would be acne. You'll suddenly see that you have lots of acne around your chin and your cheeks area. Third will be hirsutism, which is the hair growth, like a male pattern hair growth, but on the face. You will see hair fall and bald patches. That is the fifth symptom. You will see women who are older and are married will see many symptoms that are affecting their intimate life as well. So if you see these symptoms in yourself, it is best to consider the first person to go to is a gynecologist. But there is no evidence or any research that says that PCOS can be finished. That is wrong. This is a myth. PCOS can only be managed and similarly go into remission like diabetes. So how can you achieve that? Always remember, I've said this many times and I'll say it to you again, that PCOS first line of treatment will always be diet and exercise. Medication will be like a supplement that follows up later. But the first line of treatment will always be diet and exercise. What kind of diet, you'll ask? What kind of exercise, you'll ask? Every woman is different with their own PCOS. Your PCOS cannot be similar to another woman's PCOS. So your diet cannot be matched to hers. Everybody needs their own customized lifestyle of eating. How can you achieve that is considering a clinical nutritionist where you're comfortable with, but most likely you have to consider a nutritionist that is well versed with PCOS. How can you know that? So that means she's well versed with women's hormonal health as well. Another thing would be exercise. HIIT, they say, is the best for PCOS, but again, there are evidence that has supported and not supported. Like I told you, every woman is different and every woman needs different ways to tackle it. So for some people, yoga and slow workouts work the best for their cortisol. I'll explain cortisol later. Second, for some women, HIIT does wonders for their periods. They see that the workout and their periods come. I'm sure you can relate so far. So what is cortisol and what role does it play with PCOS? You see, when you have PCOS, there are two things that is happening. Number one, your male androgens are high. So high androgens bring like hirsutism, hair fall, acne, irregular periods, low sex drive. If we talk about insulin resistance, what happens? Sugar cravings, irregular period, belly fat, arm fat, you will see like what's happening, you don't understand. And these cravings are so intense that you cannot control. So how can you tackle this? What is the way to tackle this? So again, lifestyle, nutrition, exercise. These things really need to be like your first line of treatment. But also, walking has shown a lot of benefits with women in PCOS. So even a 30-minute walk can do wonders to you. So again, what are we talking about? Cortisol. So let's talk about cortisol. So what happens is whenever a PCOS woman is stressed, when she cannot tackle her stress enough, her cortisol just right sits and wrecks everything. Now, little stress is really good for the body, but major stress is not good for the body. So it's similarly with PCOS. Major stress, cortisol gets high, the symptoms exaggerates, and things go haywire. Now, PCOS is not similar to endometriosis, so do not confuse the two. Okay, PCOS is a disease, a symptom, and a health issue on its own, and endometriosis is a health issue on its own. So do not mix up the two and do not follow the same treatment line for the two. Lastly, considering a gynecologist and talking through all your symptoms one by one with them is the ideal way to start, rather than just going and taking medication and walking out of the room. I hope this helps you.